Johnson, Ranking Member Blumenthal, subcommittee members, it's an honor to present my insights, my analysis, my clinical experience on this very important topic. The first time I testified at Homeland Security and Governmental Affairs, before a word came out of my mouth, Minority Senator Gary Peters said, what America was about to hear was misinformation. I didn't even know what he was talking about. I had never heard that term before in academic medicine or in important deliberations. That's November 19th, 2020. What was he doing? He was using an old communist propaganda technique. He was attempting to gain leverage over me before a word ever came out of my mouth. We should never have our public servants ever try to gain leverage over anyone who is coming to Washington to help the nation on an important issue. As introduced, I'm an internist, I'm a cardiologist. I believe I'm the most published individual who's ever testified on matters related to COVID-19 in any of these hearings. I've seen and examined more patients. I've examined more data. And I'm one of the most published people on the topic in the world. And as a cardiologist, I can tell you, my role in this was to fight disease, preserve life, and above all, do no harm. Do no harm. Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem. There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues, New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection is ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Say, Dr. McCullough, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man. Just a few days after Pfizer, he comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart. It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine that's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology, 2 boys, aged 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified. They request an autopsy. They call in University of Michigan and University of Minnesota to look over what are they finding at autopsy. Conclusion, it's Pfizer COVID-19 vaccine myocarditis, unequivocal. These are autopsy-confirmed cases. So for all the mothers in the room, how would they feel if they found their children dead after taking a COVID-19 vaccine? This is in the peer-reviewed literature. This is not misinformation. Everyone should be paying attention to this. This is not conjecture. This is in the peer-reviewed literature. So we started to ask ourselves, what is going on? Turns out that Pfizer and Moderna in Janssen are the genetic code for the spike protein. The spike protein is the damaging part of the virus. The spike protein is loaded into the body and it causes tremendous damage in some. Acute myocarditis appears to have some genetic predilection, and all of the vials of the vaccine are not the same. But I can tell you, I'm concerned that until the vaccines are stopped, there will be cases of acute myocarditis. And to finish, we've had 216 vaccine deaths this year alone. So if the vaccine campaign continues, we have to look at what are we getting out of it now, 4.5 years of the campaign, and how many more people will die.